Hello, my name is Dr. Corey Mitchell. I am a family physician with Valley Health at locations in Fort Gay and Steptown. So at Valley Health, preventative care is of utmost priority, and we want to help you as the patient make it a priority as well. Sometimes preventative health can be very intimidating, and I think sometimes for patients it's easier to ignore it than to face it. But what we want you to know here at Valley Health, as healthcare providers, we're on your team. We want to help you do well, and we want to see your health do well, and that's our utmost priority. So I'm here today to talk to you a little bit about vaccination recommendations for adults. In general, there are three vaccines that we most often talk about, and those would be the Influenza Vaccine, the Pneumococcal Vaccine, and then what we refer to as Zostavax or the Shingles Vaccine. First and foremost, the flu vaccine we recommend on a yearly basis for all patients, but especially for our patients who are elderly or who have significant health conditions, as the influenza virus can be a very serious virus for these folks, and so it is important that we vaccinate each year for that. The pneumonia vaccine or pneumococcal vaccine is one that we recommend from ages 18 to 65 for certain populations of people, and that would be people with such things as diabetes, any kind of lung disease, whether it's COPD, emphysema, asthma, or folks who have maybe chronic kidney disease. These folks should have this every 5 years between the ages of 18 and 65. Currently, our guidelines say that at age 65, that all folks, regardless of medical conditions, should have a pneumococcal vaccine, as well as a Prevnar. Both of these fight pneumococcal disease, and so it's recommended at age 65 that you have one of each, separated by at least a year. Finally, one more vaccine that we typically recommend for adults is the Zostavax, which is commonly referred to as the Shingles Vaccine. We recommend that starting at age 60, and that is a vaccine that here at Valley Health we don't necessarily administer in office. That is something that the local pharmacy will provide, but what you need to do is speak with your primary care provider, determine if this is appropriate for you, and if it is, they can provide you with a prescription that you can then take to your pharmacy and have that vaccine administered. So again, on a final note, we would encourage you to take time to sit down with your primary care provider and discuss some of these preventative health measures that we so strongly encourage.